as Action Against AIDS Germany conducted these interviews in April 2022 for the preparation of our joint conference, Get Back on Track, the Global Fund's contribution to achieve the 2030 Sustainable Development Goals, that we organized prior to the Global Fund replenishment.
Our aim was to highlight the Global Fund's respect, contribution and support for community health systems as part of its approach towards health system strengthening. Thanks to Febi from Malawi,
Mirinda from Indonesia,
and Nooliet from Rwanda.
My name is Nooliet Kabanyana. I come from Rwanda and I work for a national network for NGOs that is coordinating 139 local NGOs that are working on health, on HIV/AIDS, health promotion and human rights. My motivation to do this work is all about improving the living conditions of the vulnerable population in terms of accessing quality healthcare services at the community level and at the health facility level. In malaria, according to the national strategic plan that we already have in place at country level, that is really defining the areas of intervention that needs to be done around the control of malaria. The national strategic plan recognizes the vulnerable population as the key vulnerable communities that needs to be targeted towards the malaria control. For the vulnerable communities that are really considered in the national strategic plan, they are the easy to reach population and they are the hard to reach population. Among the easy to reach population, we have in prisoners, we have rice farmers, we have people in the mining sector, we have adolescent girls and young women, we have pregnant women, and we have the youth in boarding schools. And then among the key population who are the hard to reach population within the malaria strategic plan, we recognize the female sex workers as the hard to reach population. We recognize the truck drivers as the hard to reach population. We need the community health system strengthening because we need to get ready and prepared for the next coming or future pandemics that may come in place to help us control them. About the community health system strengthening, we recognize, first of all, the Global Fund support at the country level on what they are really doing in terms of fighting HIV/AIDS and TB and malaria. So coming back to the malaria part or HIV part related to the community health system strengthening, the Global Fund has invested in Rwanda and started working with Rwanda since 2002. Coming to 2020, when the first case of COVID-19 was announced in Rwanda, it was a scaring period, and most of the systems that were in place, which were supported by the Global Fund, are the ones that used also during the period of controlling the COVID-19, because the country was not prepared for the pandemic, COVID-19 pandemic. So we really recognize what we had in place. And then coming back to the community side, there is still a huge gap, because we are talking about reaching the last mile and closing the gaps by 2030. Coming back to the community part, we find that communities, vulnerable communities and civil society play a key and meaningful role towards the reduction of the new HIV infections, towards the malaria elimination. But then when we come back to the side of the communities and CSOs, we find we are not really ready, we are not strong enough, where we need the support from the government and from the partners to make sure that the systems for communities are really strong enough. We are talking about community-led monitoring. This is where the people, affected people, who affected people by HIV, TB, and malaria are able to monitor the quality of healthcare services they receive. This means if, for example, they need to monitor the quality of services they receive, they need to be understanding the tools that are in place. They need to be understanding on how to assess. If you talk about the quality healthcare service, what do you mean? Do they understand it? If they see the issues, do they understand how to report them? Do we have the reporting systems in place? Do we have the technological systems in place? Do we know how to use those systems? Do we have the linkage for the community technological systems in place linked to the national ones? So when we're talking about that, we find there is still a gap in the community health systems that needs to be built, or if they're in place, they need to be strengthened, and the communities themselves need to be empowered on the use of those existing or the new systems that will be developed so that we are able to effectively implement the programs. The Global Fund makes a huge difference because it has a structure in the countries where it's implementing its programs related to HIV, fighting HIV, TB, and malaria. It has a structure of country coordinating mechanism. That country coordinating mechanism, it's a CCM where the CCM brings together different key players in HIV, TB, and malaria response, including the government, the development partners, multilateral and bilateral institutions, the civil society organizations and communities, and then the academia, where they discuss around the program, the finances, where do we still have the gaps, so that we are able to agree on where to invest when the country is doing the priorities, is developing the country concept to be submitted at the Global Fund. So it's really a critical space, because this is where we bring in the voices of the communities and the vulnerable population to make sure that their priorities are really considered, and what is being planned at country level responds to the needs of the vulnerable population. The involvement of the women, it's very key, because we say that in the African culture we say an empowered women can make a change. And starting from where we come from in our families, we can see it from there. When a woman decides to implement something, it works out. So in all these programs of health, like HIV, TB, and malaria, so if women are really empowered and put at the forefront, they can contribute and play a meaningful role towards the HIV, the reduction of the new HIV infections among the women, the malaria elimination. For example, let me say on the side of the malaria part, when a woman gets pregnant and gives birth to a child, it keeps on following her, like she's the one who is responsible to put and hang the mosquito bed net, and yet it should be a responsibility between a man and a woman. But then women, once they're empowered on the effective use of those mosquito nets, bed nets, they can also empower their husbands to say, hey, look, when I'm not here, you can also do this, because we know that children under 5 years, they die of malaria. And we are seeing that globally, a child dies every minute. Imagine the lives that we are losing. Suppose these women are overstretched. What could be the role of men? So if a woman is empowered, then they can also change the mindset of men, so that the men also can be meaningfully involved and play a key role around there. The stigma and discrimination around people living with HIV, even the key population, we need also to think about them. We need to make sure that to reduce the stigma and discrimination faced by people living with HIV, people affected by TB and malaria is reduced. We need to make sure they are fully involved in the programming, they are fully involved in the implementation of these programs, they are fully involved in the monitoring and evaluation of the services that are delivered at the community level and at the health center. Because once they are meaningfully involved, they will own these services because they're the ones to receive them. And then the rest is just to educate, to make sure we train the healthcare providers on how to deliver the quality services so that we maintain those affected people who are supposed to be receiving these services in a quality and effective manner. So this is how we will be able to fight the stigma and discrimination faced by people living with HIV, affected with TB and malaria, including the key and vulnerable population. We strongly commend the German government's support towards the past 20 years, where the Global Fund has managed to save 44 million lives of people living with HIV, TB, and malaria. Through the Global Fund partnership, where Germany is part, a lot has been quite done. And more especially when I'm talking this, I refer where I come from in Africa. People were dying. People had lost lives of their aunties, children, but through this great partnership of the Global Fund, where Germany is a founder member of the Global Fund, they have really put back the smile on the faces of these families affected by HIV, TB, and malaria, families that has lost lives of their relatives because of HIV, TB, and malaria. In this 7th replenishment, it's very critical for the government of Germany to increase their contribution to 1.3 billion euros to the Global Fund, so that the Global Fund's partnership is able to strengthen the systems for health within the countries where they support, and then so that those countries are really ready and prepared for the future pandemics, because we have learned a lot during these COVID times, where we found the systems that were already there, built by the Global Fund the last 20 years, were used for controlling COVID. So once the country's health systems and communities' health systems are strong, I'm very sure that in the next future, we would be able to fight with any pandemic that would come in place.